How are we doing? Happy Monday. Welcome back to another edition of Learn with Lo. I'm excited to continue to build on our autoimmunity conversations. I had a lot of really great DMs and questions coming through, so I know that this is a relevant topic for so many of you guys, either personally or even someone that you know, whether it's a family member struggling to kind of find answers because they know that they have an autoimmune diagnosis, or it's something they've been living with for a while and didn't necessarily realize that there were other options for support and treatment strategies when we start thinking about where does autoimmunity come from, what is some of the root causes of it, because it's really going to take a team. And that's something that we'll talk about a little bit more today as we get into what does that integrative team really look like. And I think in a big picture sense from the world of healthcare and world of medicine, I sure hope and can kind of feel that mindset shifting to where individuals are recognizing that they're not going to necessarily find a one size fits all when it comes to being able to proactively manage some of these more complex conditions. And it really is going to take a team, and recognizing that it doesn't just have to be traditional medicine. It doesn't just have to be functional medicine, but it can really, how can those worlds really marry and combine together to get people feeling their best, but also proactively living in a way that may minimize their risk for some of these in the first place. So that's what we're going to really build on today. So if you were with us last week, we laid this foundation of what is autoimmune disease, what are the 80 to 100 different autoimmune conditions that are out there, and how do we really define what's happening in an autoimmune disease process? So we got an opportunity to talk about autoimmune disease really being a dysfunction of the immune system that is then turning around and targeting a particular tissue or system in the body, causing tissue breakdown or tissue atrophy. So at its root, it is an immune system issue with a downstream catabolic target, right? Now, the hard part with a traditional medicine approach is that if you do get an autoimmune disease diagnosis, normally you are then sent off to a specialist of the target tissue, right? So if you end up with multiple sclerosis or MS, it's like, oh, you see you see a neurologist. Or if you end up with Hashimoto's, which is an autoimmune condition targeting the thyroid, then you see an endocrinologist. Or if you end up with a psoriasis, an autoimmune condition that targets the skin, you see a dermatologist, right? So you can start to see how traditional medicine really shuttles you towards the specific specialist that's going to help you manage the symptoms of the target tissue. Absolutely part of our care team. We definitely need that. But we also have to recognize it's like, oh, so if I'm just managing the symptoms of the target tissue, that's not really fixing the cause. And no, it's not. Because at its innate system, this is an autoimmune disease that lies in the immune system. 70% of the immune system lies in the gut. So if we're not having other parts of our treatment strategies or care team that are involving more of a root cause scenario, then we are just going to be stuck in this kind of symptom management loop for the rest of our lives. We'll have a flare and then we calm it down, and a flare and we calm it down. And for most people, that might be fine, but for other people, they're like, that's not the quality of life that I want to live, just managing symptom flares for the rest of my life and trying to progress the disease from getting any worse to the point where I'm debilitated or out of work. It's like, yeah, that doesn't seem like quite the best strategy, especially since we have so many other tools and resources and we know so much more about the human body and how it functions as a whole. So that's really where we left off last week, was talking about just laying some groundwork, some foundational knowledge, and letting you guys in on the fact that an autoimmune condition really is the result of three perfect storms happening, right? We have one, a genetic predisposition, but there's hundreds of millions of people that live with a genetic predisposition of autoimmune disease and never actually express that autoimmune disease, because the genetics also require a trigger or an epigenetic influence, whether that is stress, nutrition, environment, toxin exposure, prior infection, all sorts of things that contribute this. And then the third piece of that equation is a leaky gut scenario or intestinal permeability, where we're getting food particles or pathogens, things that shouldn't be getting into the bloodstream or leaked through the intestine into the bloodstream, which is where that immune system really mounts its ultimate response, right? So when you start to think about that big picture, I don't want to get too much. I want to give you the science, but not so much that it feels like debilitating, just enough that it feels like, ooh, okay, I'm starting to understand and envision how all of these things are connected together. And I want to let you know how enough of the science so that you can understand where the root cause of a lot of these things really live. Because that's where I'm really passionate about, is not only just bringing you that education so that you feel like an empowered part of your own healthcare experience, but you can also start to ask better questions. You can ask your specialists like, hey, do you have any recommendations of different nutritionists or different specialists, functional medicine practitioners that can help support my nervous system, that can help support my gut, that can help really look at dietary or nutritional triggers and deficiencies that could be contributing to my symptoms. It's like, you'll probably throw them off guard asking for those types of things, but that's you trying to assemble your overall care team, because you realize that this is a multi-system approach. This is not just me treating and managing symptoms of the downstream target tissue that just happens to be the target of my immune system, but you're not really actually putting any support into the immune system or the gut in and of itself. That doesn't make a whole lot of sense. So let's really start to dig into where we kind of get into this three-legged perfect storm, so to speak, and start to talk about how autoimmunity progresses, and we can recognize it a lot more proactively. What I also talked about last week was setting the stage for this conversation, that a lot of times I tend to see gut issues, hormonal imbalance symptoms accompany an autoimmune disease diagnosis. So a lot of individuals or patients that come to me in practice, it's almost like the autoimmunity piece of their initial consult forms is like an afterthought, right? They're like, yeah, I'm really struggling with anxiety, bloating, constipation. I just have chronic pain all the time. Oh yeah, and I also have Hashimoto's. And it's like, so that it was just almost like, oh, I just tossed that on there as if it's like seemingly unrelated and not like, oh yeah, I have that too. I forgot to put that on there. It's like, oh my gosh, like that right there tells me a lot about where things have kind of progressed, where they might have started, and honestly kind of the spectrum that you're in terms of managing that diagnosis pattern, or even reversing a lot of the gut and hormonal imbalance symptoms too. So this is not something, when I think about autoimmune disease or gut issues, these are not things that just pop up out of nowhere. And that's really, again, one of those unpopular opinions I think that's out there, or unspoken things, is that it's like, oh yeah, I just developed this out of nowhere. It's like, no, this was building for quite some time. We created this perfect storm through a series of different life events, life choices, lifestyles, and now we're really dealing with the downstream ramifications of it. So when we look at an autoimmune disease, it's usually been present for a while, or it's been building for a while. It's just a matter of recognizing the signs and symptoms as an individual and knowing how to speak up about these things and seek better opinions about, right, how to manage it. So when I think about the 3 stages of autoimmunity, the first stage, stage 1, is called silent autoimmunity. It's called silent autoimmunity for a reason, because most of the time some antibodies, like if we did specific labs to run, antibodies could be present in small amounts. But like the symptoms are probably vague, or there's little to no pattern in the symptoms, enough that it's like, we kind of just ignore it because we can't develop a rhyme or a reason to it. So we just decide like, oh, that's normal. Oh, that's just a normal part of aging, or normal part of being a woman, or normal part of being a parent, or I'm just sleep deprived, or all of those things. And part of those things could be true, but we have to recognize that some of those early signs of hormonal imbalances or gut issues are really just setting the stage for eventually developing some of these conditions if we don't act on or recognize them now. So the first stage of autoimmunity may be fatigue, brain fog, muscle aches, trouble recovering from workouts, chronic injury, right? This phase can last months to years. And this is when people start to dip into, what do I want to call it? Like self-medicating strategies. So if we're dealing with like fatigue, body aches, trouble falling asleep, staying asleep, brain fog, what are we reaching for? It's like, this is where our caffeine intake starts to creep up, right? Because we're desperately trying to find energy, but we just think it's normal. So it's like, before we know it, it's like the 1 cup of coffee becomes a big cup of coffee, becomes coffee all morning, becomes energy drink in the afternoons, becomes diet soda. Regardless of what it is, it's like we're desperately trying to seek energy. Similarly, if we're feeling like that fatigue and we can't sleep, or we're not sleeping very well, alcohol intake can also start to creep up, because we're trying to almost anesthetize or sedate ourselves to sleep, which alcohol is the #1 most commonly used sleep aid out there. So it happens. Also, I would say that this is where we start to see some individuals start using other things like food to cope with either the stress or the energy too, because again, our body knows that food is a source of energy. So a lot of times we can lean on like more sugar intake, because we're desperately trying to find this like dopamine hit that will get us out of this like brain fog, fatigue, muscle aches type journey. And we're just like desperately trying to recover, almost like that first state where you start to feel ill or you start to feel sick. What do you crave? You crave comfort food, you crave carbs, you crave like all of those things. And it's like, we're just living in that state where we just always feel like I'm about to come down with something, right? It's like, so there's an immune system response mounting here behind the scenes. It's just manifesting itself as things like fatigue, brain fog, muscle aches, changes in sleep patterns, and all of a sudden our caffeine and our alcohol or our sugar intake kind of starts to creep up, but we don't start to put 2 and 2 together. So this is that silent autoimmunity where people just kind of blow through this or push through this every day, instead of being like, I wonder why I'm starting to feel that way. Maybe I need to start making some concerted changes now in how I'm proactively managing my health so that this doesn't become something bigger, right? So stage 1, autoimmunity, you can see, you're like, oh yeah, I could see how that could be really easily ignored or overlooked, especially in today's day and age. Then we get into stage 2. Stage 2 is autoimmunity reactivity. So this is where, yes, we have the antibodies present if we were to test or to look for them, but we also now have the symptoms that are starting to occur. But there's not necessarily like enough damage to the target tissue to full-blown really recognize that this is what's going on. So that stage 2 autoimmunity reactivity is usually where people start to chirp up. They're like, I don't feel well. Like, this isn't just like muscle aches anymore. This is like chronic pain, or this is like known and visual, like autoimmune, or not even autoimmune. This is an inflammatory reaction, like their joints are starting to inflame, or they're getting like a Crohn's disease where they're starting to get actual bouts of digestive upset, or like a celiac where they're getting bouts of digestive upset. So we're starting to see this inflammation process happening in the body, either like visibly in the joints, visibly in the gut, or we're starting to see like memory loss, poor like recognition, forgetfulness, like brain fog. Literally had a gal who came to me when she first started coming to me, like I kind of recognized it as early signs of this, but she was like, I could be driving, Lauren, and she's like, I forget how to get home. I'm like, early signs of like we have some brain inflammation kind of going on here, right? So it's like, if we're not recognizing these things, it's like, this could be some of those things building to a bigger picture. Now, she did not have any autoimmunity at that point, but it's like me recognizing and listening for some of these signs and stuff. It's like, ooh, I want to do something about that. I'm not just going to laugh about it with you like we laughed about it together, but she's also like, but it's also kind of scary. I'm like, yeah, that would be very unnerving to just be driving and be like, where the heck am I going? Oh yeah, and like to how many things we do every day on autopilot, but then when it doesn't become autopilot, it's like, man, I have to actually remember, like, how do I get home from this location that I drive to multiple times a week? Those are some of those kind of like early signs of brain fog where it's like, let's really look at this a little bit more from a whole body standpoint before we just let this get like full-blown issue, right? So this is usually where people are starting to chirp up about their symptoms, but you may get like basic labs drawn, but we're not getting in depth or comprehensive enough labs drawn. And so a lot of times in this stage 2, individuals are actively seeking going to their doctor, and then they're getting dismissed or brushed off because the labs that professional is running aren't quite in depth enough to really see. And so they're like, well, labs all look normal. Let's just check again in 6 months. And it's like, oh my gosh, so much could change in 6 months because this person's like blatantly expressing that there's a pattern going on. And the fact that they're saying something about it is like, let's look bigger, let's dig deeper, versus just accepting labs are normal or it's a normal part of how you should feel. So that's stage 2. Stage 3 is where we get into full-blown autoimmune disease, and we have antibodies present, plus we have symptoms, plus we have downstream target tissue damage. So again, in like a Hashimoto situation, it's like there are overt TPO antibodies present in the system, and the thyroid labs are starting to look wonky, right? It's like, and we have symptoms of thyroid issues. We have trouble losing weight, dry hair, dry skin, dry nails, constipation, depression, low mood, low energy, right? And it's like, oh, now we have that full-blown issue, when if we probably would have been looking at this earlier, we could have caught this a lot earlier before. Now we're seeing like the thyroid actually start to slowly atrophy because the immune system is mounting an attack. Or joint pain as a result of rheumatoid arthritis, or, you know, all of those different like downstream, like that's the target tissue, that's where I'm starting to get symptoms. So this is where, like I said, you'll actually maybe get the more in-depth testing or diagnosis of an MS, a rheumatoid arthritis, a lupus, a Hashimoto's, a celiac, a Crohn's, a psoriasis, a Parkinson's, like all of these things, ulcerative colitis, it's like all of these are under that autoimmune umbrella. And not very often do we get them all tied back to the gut, right? So that's really what I want to empower you guys with, is letting you know it's like, hey, there's different stages of how this autoimmunity is going to progress. And I don't want to ever instill fear in someone being like, oh, like I forgot where my keys were at, and like I must be headed down the road of MS. It's like, no, I'm just trying to get more proactive education out there for people, especially since 70% of autoimmune conditions occur in women. And that is, again, one of those passion points, because I feel like a lot of women, we go through so many changes with our body, whether it's our fertility years or raising children, caring for aging parents, approaching menopause. Like a lot of times we just we're so out of touch with our body because we're told that everything is just normal. Oh, that's just how you should feel. Oh, that's normal. And we're so quick to prioritize everybody else's comfort and everybody else's needs above our own, because just naturally women tend to be that caretaking type of role. And then we end up with the scraps. So that's what I'm more passionate about, is just letting you in on like, hey, if you're starting to feel these types of things, it's good to start to have some conversations with some people. And if you don't have a professional that's listening to you about these things, then find someone who will, and find someone who will run a more big picture comprehensive analysis. And maybe, again, it's not an autoimmune disease piece yet, but it's like, hey, we caught all of these things super early, and it actually is an adrenal issue going on. There actually is some gut issues going on, or there's some imbalances in some sex hormones going on. And I'm super glad that you brought this to our attention now, because we can start to layer in a well-rounded integrative team to help you manage this, and it won't ever become something full-fledged acknowledge something bigger, because it is harder to treat at that point in time when it becomes that kind of overt, really, really deep into a flare, an autoimmune flare, that is. So, moral of the story, if you have gut issues or you know you have hormonal imbalance symptoms, it's like address them proactively and start to work with someone that's really listening to that full approach. So understand that when it comes to autoimmunity, as you guys have discovered, it's like, oh, okay, so my immune system's in my gut is impacted by my hormones, and all of this is going to or could lead to a bigger picture. So yeah, it makes sense when someone is handed an autoimmune disease diagnosis, this should be a referral team, right? In my personal opinion, I know that even me in and of myself, I love working with individuals that are struggling through autoimmunity because I feel like I can help them a lot, but I am just one piece of the puzzle. It's a total integrative team. So when you think about whether you have an autoimmune condition or you know somebody who is struggling with an autoimmune condition, encourage them to assemble a trusted team of people. It probably and should, in my opinion, include a nutritionist. It should include somebody that it's like, hey, if this is an immune system, a gut health issue, we need to be looking at, are there potential food-based triggers? Are there any changes and modifications we can be making to dietary strategies to lower stress, lower inflammation in the body, either temporarily and forever? Is there anything we can do to correct nutrient deficiencies to try to build natural sources of energy and not rely so much on caffeine and alcohol? Maybe that same nutritionist is also someone that is their gut health specialist. Sometimes this can be the same person. Sometimes you might need to look elsewhere for someone that's there to also support conversations around toxin exposure, microbiome, dysbiosis, supporting, good gut motility and drainage and detox pathways, as well as helping with circadian rhythm and how all of that plays into adrenal health, gut health, and the like, right? I would say that's more of kind of, again, functional medicine tends to go more towards being supportive in that route, which I think is immensely helpful. And to me, you can't necessarily have an autoimmune support team without having someone that's helping you with nutrition and gut support. Also, I think for some individuals, a physical release specialist. And what I mean by this is sometimes there can be some physical trauma, especially if there's like abdominal trauma, could be part of like an endometriosis picture or an ulcerative colitis type picture. There can be some, whether it's scar tissue adhesions in the abdominal walls from either prior surgeries, prior accidents, prior traumas, things like that. So I am big on certain individuals looping in a specialist that works with physical release, whether that's lymphatic massage, could be like a pelvic floor PT, could be even things like yoga practices and or a physical trainer that's helping with muscle balance, things like that. Then there's also the emotional release specialist. This could be someone like a therapist or anybody helping with trauma work, because I know that a big part of autoimmune disease can also even just be stress. And a lot of times stress can come up in terms of repressed emotions and how all of that works in our mental and our physical body as well too. And then finally, part of their team is definitely going to be rheumatologists and or specialists for some mitigating some of the downstream damage of whatever target tissue. So again, absolutely think that rheumatologists, endocrinologists, gastroenterologists, neurologists, like all of these people that are going to help with mitigating some of the damage to the target tissue, we absolutely need them on our team. But what they're going to be able to really provide is symptom management, right? They're not necessarily going to be supportive from a root cause approach up, which is totally fine. It's not what they're trained on. They're not passionate about it. They're more trained in like, hey, I have some heavy hitter things that I certainly don't have access to, which I think is great. So that's why I'm all about more of an integrative team. And everybody's integrative team looks different. I just wanted to at least be able to provide a conversation around, hey, autoimmune disease has a really big connection back to gut and hormonal imbalances, which absolutely are going to come through really the three main pillars that I work with within my container with individuals of nutrition, movement, stress management, lifestyle, right? Those are really my wheelhouses, and I think that those can be very, very supportive and an essential foundation to an autoimmune picture that isn't just managing the downstream damage to the target tissue. So I know, like I said, I'm talking wide picture of lumping all of the autoimmune disease under the same umbrella because I think they have a very similar etiology. So regardless of what the target tissue is or what the diagnosis is, I don't think from a functional and a foundational approach, it really has to be that different because we know at the foundation, there is an immune system and a gut needs support here. So that's where I think I loop in as part of an integrative team, but by no means is it an end-all be-all type strategy. And I would honestly question anybody that says that they are a one-stop shop for this particular autoimmune disease umbrella, because it's just way too complicated and we're learning more and more about it all of the time, that I think it really does require kind of an integrative approach. So recognize your signs and symptoms of kind of this 3 stages of that autoimmune disease progression. If you have symptoms, it's a great opportunity to really be proactive about it and or be able to at least feel empowered as a patient to ask the right questions to your practitioners as well too. So I love talking about this autoimmune piece. Hopefully, like I said, this is resonating with you guys and giving you some more key takeaways. If this is really helpful for you, I'd love to hear from you about any additional questions that I can dive into in our next series next week. I have some ideas and some directions, but I think a lot of the questions that I get between week to week really help drive the direction that I know you guys want to hear from and have information on as well too. If you know of anybody that's struggling here in this area, please don't hesitate to send them this and send them my way as well. So have a wonderful Monday and a wonderful rest of the week, and hopefully you guys are able to join me next Monday for more Learn with Lo.